statewide efforts to end the pandemic and protect Hoosiers from the deadly coronavirus.
Well, it's important because so many people are dying.
Tonight, frontline workers are telling their stories and health experts are answering your questions to help fight misinformation about the COVID-19 vaccine.
Stay the course. Don't let down your guard. We will get to the other side of this pandemic.
From questions about vaccine availability and rollout to why you still have to wear a mask after getting your shot, we're helping you know the facts.
And good evening to you. Thank you so much for joining us for this special town hall on the COVID-19 vaccine. We're so glad you're with us for this next hour. I'm Fanchon Stinger.
I'm Debbie Knox.
And I'm Beershell May. Now, our viewers have reached out to us with concerns about the COVID-19 vaccine.
And that's why we gathered a panel of experts to answer your questions so you can know the facts. We are joined by Kristen Kelly, Director of Infection Prevention at IU Health, Dr. Ram Muleti, Chief Physician Executive at Community Health Network, as well as Purdue Professor of Virology, Dr. Suresh Mittal, Regan Steve President, Dr. Peter Emby, and Zach Cattell, President at the Indiana Healthcare Association. We want to thank you all for being here.
Now, before we do get started, let's review where we are right now with our vaccination efforts. The state of Indiana has administered the first dose of the vaccine to 362,000 people since December 14th. 87,000 people have received both doses. Right now, the state is vaccinating frontline healthcare workers, first responders, long-term care residents, and people over the age of 70. One of the most popular questions we received from many of you is, when will it be my turn for the vaccine?
That's right. And the answer to that question depends on how many doses the state is allocated each and every week.
Yeah, the state health department couldn't provide someone from tonight's town hall, but we were able to talk to Chief Medical Officer Dr. Lindsay Weaver a little earlier, and this is what she told us.
Our supplies have been pretty consistent over the past couple of weeks, and we've been told to expect much of the same in the coming weeks. It's been around 80,000 doses. Now, a couple of weeks ago, we were taking out of that allocations for the long-term care federal partnership to vaccinate in our long-term care facilities. But right now, all of that we are getting directly to the state for us to push out to all of these other locations.
And we'll be hearing more from our exclusive interview with Dr. Weaver throughout our town hall.
Right now, we want to get to our first question to our panel to address a concern that many of you have told us about. Many of you dealing with medical conditions, people living with asthma, rheumatoid arthritis, and sickle cell disease. A lot of you want to know, is the vaccine safe for me? Well, Dr. Muleti, I want to start with you on this one. Rather than going through the big list of all the medical conditions that are safe, let's talk about what medical conditions should stop someone from possibly getting the vaccine. Dr. Muleti, can you hear us? All right, looks like we're having some technical difficulties with his connection there. We're going to go next to Kristen Kelly in terms of staying on the vaccine safety topic here. Bev from Lafayette has concerns about a possible allergic reaction. She says, I had a serious reaction to penicillin and Mandol. Can I get the vaccine? We also heard similar concerns from people who are allergic to the flu vaccine, maybe allergic to latex. Ms. Kelly, I want to hear what you have to say about the allergic reactions to vaccines available now. If you want to speak to the other previous question as well about medical conditions, you are free to do that too.
Sure. So when you arrive at the clinic, we will ask you some preset questions related to your past history with shots. And if you have a history of severe anaphylaxis or reactions to old vaccines, that history is really important to make sure that you don't proceed forward to get a shot if it's not safe to do so. If you have minor allergies or moderate allergic response, we'll probably monitor you for a little bit longer, but you can expect that we'll ask those screening questions to make sure that it's perfectly safe for you to move forward and get this.
Okay, that is very helpful information. We're going to try and go back to Dr. Muleti right now. Dr. Muleti, the first question we had for you was dealing with people who have medical conditions, people living with asthma, rheumatoid arthritis, sickle cell. And a lot of these people are wondering, is the vaccine safe for me? So rather than listing all of the medical conditions that are safe, Dr. Muleti, I want to talk about conditions that should possibly stop someone or make someone think twice before getting the vaccine.
Actually, that's a great question. I think what people need to remember when they're taking the vaccine is what is the risk of me getting COVID versus the risk of me getting the vaccine. So there's almost no health condition where COVID is a good thing to have. And so except for severe anaphylactic shock, you really should be getting the vaccine because the long-term side effects of COVID can be terrible with any health condition. While we don't know the long-term side effects of the vaccine yet, there's been nobody that's died from the vaccine. So when you're debating that, do you want to get COVID or do you want to get the vaccine is really what you need to answer for yourself.
Okay. An important thing to consider. And for those of you watching right now who may have concerns about allergies, the FDA does have a list of ingredients for each vaccine listed. We have a link to all of that on our websites, fox59.com/links. You can also check cbs4indy.com/links. Birsha?
All right, next, let's talk about the timeline for developing immunity after getting the vaccine. So Molly from Indianapolis asks, why are some people testing positive after receiving their second vaccine dose? She adds, does the vaccine work like the flu shot, where you can still get sick, but the symptoms won't be as bad? Professor Mittal, you've dedicated your career to studying vaccines, so let's ask you this one. What can you tell Molly about this?
Okay, so the vaccine which are there, when it's being used after 2 doses, these vaccine will provide a very subsequent protection. So people can get COVID, but they won't get sick, and more likely they are not going to transmit the virus infection. So having the vaccine is a good thing. Everybody should have it. Since they are not going to get the bad effect of the disease, even if they get infected, they are not going to see the sign of the disease. So that's why some people might be finding out from the information, some people might got infected, but they never get the full-blown disease.
So it sounds like it's...
That's the way the vaccine is protecting them.
So as I say, it sounds like it still gives you that layer of protection, even if you should get it after the vaccination. We do want to move on here. There's another question from Vivian in Indianapolis. So let's take a look at this.
Should one have the swab testing as well as the antibody testing prior to getting to vaccine? And if that is not done, is there consequences of possibly severe illnesses?
So Dr. Yelati, does a patient need to confirm they don't have COVID before getting vaccinated? Otherwise, are they at risk?
No, absolutely not. There's no reason to check it. Whether you had COVID or not, the vaccine is safe in both categories. And so the most important thing is to have immunity. And so no risk of taking either vaccine if you had COVID or not have COVID. So there's no recommendation for pre-testing.
All right, so this one, that topic actually leads us into our next question. It's from Gloria and her husband. They're both in their 70s, so they are eligible for the vaccine here in Indiana, but they both came down with COVID earlier this month. So here's what they want to know.
Our question is, should we get the vaccine in 90 days after the antibodies are gone? Should we get it sooner so that we don't have a gap between our antibodies and the vaccine? We just don't know when to get it. Everybody's signing up and we aren't. We're waiting because we have antibodies.
Kristen, what's the recommended timeline here for Gloria, her husband, and people who might be in the same situation?
So what we're telling folks is to go ahead and once you're cleared from your signs and symptoms, if you have them, and you've finished your isolation period, which can be around 10 days or so, then you can move forward with getting the vaccine. There is not a lot of data on reinfection within 90 days. So if folks do want to, they can wait that 90-day period and then get your vaccine. But the official recommendation is after you've cleared your signs and symptoms in your isolation period, you can move forward.
So, Kristen, would there be really any situation where someone should delay getting it if it's really okay with them, like something they intend to do and they fit into the age group? Is there a reason why someone should say, let me wait for a while?
One recommendation is if you've got monoclonal antibodies, then to wait 90 days from that treatment. Even though there's not a lot of evidence, that is the latest ACIP recommendation. So that would be one.
Thank you. Our next question is for Professor Mittal, and it comes from Vicki in Indianapolis. Take a listen.
What I would like to know is once somebody's vaccinated, can they give me COVID? As I'm a yoga instructor, so I have people coming in and out of the studio all the time. So I want to know that, am I going to be safe or do we still need to practice all of our precautions?
Professor Mittal, will I have you answer that?
So could you explain a little bit, because the sound was breaking for me?
Like, it's just that she asked, once somebody is vaccinated, can they give me COVID? As I'm a yoga instructor, she said, I have people coming in and out of the studio all the time, so I want to know that I'm going to be safe. Or do we still need to practice all of the precautions? This is after she's had, apparently, the vaccine.
So after having the first vaccine, first dose, the protection is not going to be there. It will be after 10 days after the second inoculation. But even after that, we still have to be keeping the distance, having the mask, because still there is an unknown thing that can somebody with COVID can get infected with the vaccine and they can pass on to somebody else. They won't get sick by themselves, but they can still pass on to people who are not vaccinated. So having the distance and having the mask, it's still a good idea, even after the vaccination.
And let your immune system ramp up. It's going to take a little time before you get that full immunity, it sounds like. All right, Dr. Emby, a lot of people ask us, why do I still have to wear a mask? Maybe we've answered this, but we're going to make sure people understand this. Why do I have to wear a mask after the vaccine? Talk to us about the importance of waiting until we call, or what we build actually, what's called herd immunity.
Yeah, it's very important that, as Dr. Motala said, that we continue to take precautions. So there's a few reasons. One is that, as he mentioned, we don't necessarily know whether just because you've been vaccinated, that means that you can't be an asymptomatic carrier of the virus, and you can still pass it on to other people. And so we wear the mask to also protect others. There's also a very small chance that you could still contract it, although, again, the vaccines are highly effective and very safe. So for the most part, that's not the biggest worry. The biggest worry is really making sure we don't that we don't pass it on to other people. And that holds also for the other non-pharmacologic precautions that we recommend, the distancing and the hand washing and the other precautions that we're taking. The question about herd immunity is one that I'm sure we'll get into a little bit more, but that's a little bit more challenging. We don't really know exactly what percentage of people need to be vaccinated and immune in order to really achieve herd immunity yet with this. And so I don't think we're really counting on that, or at least not right now. Right now, we're obviously focusing on getting as many people as we can vaccinated. And even though you've been vaccinated, you still need to take precautions like wearing masks to help protect everyone. We'll start to get a much better idea once we see the numbers coming down in the population. We'll have a much better sense of what that level of immunity is that's going to get us to that level of protection for everyone else.
Okay, thank you, Dr. Emby. Our next question comes from Eva in Westfield, and she addressed it to Health Commissioner Dr. Christina Box. So take a listen.
The question I would love to ask Christina Box would be, since she's going by age only, so is she saying that someone 70 years old and above is at higher risk than somebody 50 years old that has COPD, hypertension, and I have super tachycardia?
This is a good question, and we requested an interview with Dr. Box, and the Indiana State Health Department granted us an interview with Chief Medical Officer Dr. Lindsay Weaver. So I took this question directly to her.
It's very hard, and there's hard decisions that need to be made, and we just kept on going back and looking at the data, and it just showed us over and over again that those people in those higher age categories are at higher risk of hospitalization and death. And the whole entire time we've based a lot of our decisions and what we were doing based on how our hospitals were doing, looking at the death rates, making sure that we're getting resources to those people who are at higher risk. And so we have continued with that, and I promise as soon as we have the vaccine, we will move through these different groups as quickly as possible.
All right, Dr. Weaver, thank you for that answer. Our next question now coming from anchor Tara Brantley. She is from our partner station in Fort Wayne. Take a listen.
In your opinion, do you think the public should hear from a healthcare worker who has opted out of getting the vaccine? And what kind of message does that send?
So, Dr. Uletti, I want to go to you on this one. Should we be hearing more from healthcare workers who are also skeptical of this vaccine?
I think, this is still an emergency use authorization, and we just don't have long-term data on it. So I think it's reasonable for anyone to, wonder what is the long-term safety of it. We know the efficacy, but we don't know the long-term safety profile a year or two from now, and how long does it last? But at the same time, I think what people need to keep on remembering is that we do know the long-term effects of COVID. We have 20 to 30-year-olds getting heart disease, getting lung disease, and brain issues many months after COVID. So it is correct. We don't know the long-term effects of the vaccine yet, but we do know that even if you're young and healthy, you still can get some long-term, what we call long haulers and long-term complications. So we don't know everything, but we do know a lot about COVID, and we really don't want to get COVID.
And I would imagine, Dr. Letta, you would tell patients, anyone watching, to always have an extended conversation with your primary care physician or your doctor or specialist regarding any of your questions.
Absolutely. If you have any concerns at all, you should always talk to your physician to to get the answers that you need.
Well, I want to stay on the topic of vaccine skepticism right now. Zach Cattell is the president of the Indiana Healthcare Association, representing long-term care centers, and long-term care facilities have been so much a part of this pandemic. Zach, how are nursing homes handling cases, especially when residents don't want the vaccine?
Yeah, luckily we're hearing a very great uptake by long-term care residents in particular, upwards of 100% in certain facilities and really no less than 75% across the buildings that I've been able to talk to. We're still collecting that hard data as the vaccine rollout has been going on these last many weeks. Luckily we know that as folks see and project the relaxation and visitation and some of the different things that they'll be able to do again, they'll probably be incentivized that way. But ultimately, the very first thing they have to do, as Dr. Ialetti talked about, is to have a fully informed decision, full informed consent with their physician and their care team to make sure that they feel comfortable making that choice and receiving the vaccine. So facilities are going to continue to do education with the residents and with the residents' family members and representatives to make sure they have all the information they need to make that decision.
Communication, information, always key. This was the big headline today, just coming out of Washington and coming down into the states, reporting that county health departments, many of them, do not have enough supply of the vaccine to meet the current demand. Lucy from Jeffersonville asks this. She says, I live in an assisted living facility. We are considered a high-risk population. Why haven't we gotten our vaccines yet? Mr. Cattell, what are you hearing from our nursing homes in terms of why they have not been able to get the vaccines to everyone who wants one, especially as this topic of supply now is in headlines today?
Yeah, this is important, and it's hard to explain everything, but these partnership programs for long-term care facilities are separate from the state's individual rollout. And so long-term care facilities, both skilled nursing, assisted living facilities, and some other congregate settings have worked with the federal government to roll out these vaccines. And so the federal government has provided instruction to long-term care pharmacies to schedule the clinics within the long-term care facilities themselves. And skilled nursing facilities were prioritized first because of the outbreak status and the history of COVID outbreaks in skilled nursing facilities specifically. And then assisted living facilities were second. We continue to communicate with the state health department as well as with the long-term care pharmacies themselves, and have been advocating a lot over these last many weeks to make sure that assisted living facility scheduling is a priority. And I see each and every week that more and more assisted living facilities are being scheduled. As I understand it, the health department's target for all long-term care facilities, assisted living facilities and skilled nursing facilities, is to have their first clinics done by February 15th, with skilled nursing facilities done by the end of January.
So Zach, let me follow up on this one topic here as we're talking about this. Should these facilities not get to that point, the target date that you talked about, what could be the projections here for long-term care facility residents, for staff members, and COVID numbers going up here in Indiana?
Well, we're actually seeing a decrease in COVID cases over these last many weeks, both in the number of cases and fatalities. So insofar as vaccine access is concerned, the state of Indiana has done something a bit unique that other states haven't. Staff have been able to access the vaccine all the way back to the very beginning receipt of the Pfizer vaccine. And so staff don't have to wait for that clinic to come to the nursing facility or the assisted living facility. They can register like other healthcare providers and access that at a hospital or local health department. Secondly, the governor and the health department's access of vaccine for those 70 and older, any individual 70 and older, regardless of where they live, are able to also register and go get the vaccine. Clearly, that's not as efficient as having an on-site clinic at a long-term care facility, but it is an option for individuals who can safely travel to and from a clinic in order to get that vaccine.
Gotcha. All right, Zach, thank you. We want to stay on this topic because so many of our viewers really did want to talk about the vaccine. So our next question is for Dr. Emby. Why is there such a struggle to distribute this vaccine? And is our public health system not working as it should?
Yeah, it's a very complicated issue. Obviously, we've never been in this situation before, is one reason. And in fact, the logistics of getting this distributed are quite complex. It's also the case that we've been doing this really at the level of the states. And a lot of that is because of the nature of our public health system really being distributed that way. I think that there's been a lot of different factors. We've seen the different states actually address this in different ways, and I think that's less than ideal. It would be better, of course, if there was a more common approach to this more widely. And so everybody's trying to do their best. But I think it's been really challenged for those reasons, as well as issues, as has been mentioned, around availability and around the logistics of actually getting it delivered. So there's really multifaceted in terms of why it's been so complex and difficult. But there's no doubt that we have to do better. And I think there's a lot of effort being put to actually addressing this and making sure that we have the right amount, that we actually make sure that we have a sufficient supply. And there's a lot of work happening from production all the way to distribution in that regard. Hopefully soon, in addition to the 2 that are approved, we'll have more vaccines approved relatively soon, which will also help with supply. And then actual delivery is also in the process of being ramped up. So I expect that in the coming days and weeks, we're going to see a lot more delivery and a lot better distribution. But this has been a really challenging thing to do, frankly.
And you talked about just the vaccine options themselves. We know Johnson & Johnson still waiting with that one, AstraZeneca. So a lot of things on the horizon as we wait. But in the meantime, let's get to a question here. It's about possible disparities on how effective the vaccine may be. Javon from Marion asks, is there this vaccine tested and as safe for African American males as it is for white males? Kristen, how did vaccine researchers test different demographics? And can you tell Javon what researchers found?
Sure. So in some of the clinical trials, they published the results by race, age, ethnicity, and gender. And I think that was a really powerful, transparent move forward to show that the vaccine was equally safe and efficacious in all categories. As well as that, those clinical trials, we've seen this up close and personal. So in one of the clinics that I helped to run in partnership with the state, you know, we have been giving this vaccine for almost 5 weeks now to all ages, races, genders, and it has been a great thing. And everyone has done really, really well as far as outcomes and minimal adverse events. So we're really pleased seeing that both in the studies and in real life. So I think people can really feel encouraged by that.
All right, Javon, there's your answer there. Let's continue with our viewer question. Cheryl from Greenwood wants to know, since we need 2 shots and there are 2 vaccines, does it matter if you get one from Pfizer and one from Moderna? Do you have to keep track of which brand you received first? Professor Mattel, mixing and matching not recommended, right?
Yeah, it is not recommended because both are very similar, but the dose is different. So it's always better to use the same vaccine twice rather than one vaccine one time and second vaccine. I would say no, use the same vaccine twice.
All right, so we've confirmed if you're taking Pfizer, you take Pfizer. If you're taking Moderna, you take Moderna. But Dr. Ialetti, can you choose which of these 2 vaccines you get, whether that is Moderna or Pfizer?
You can if you want, but honestly, they're both very efficacious and both have a strong safety profile. So I don't see any reason why you need to pick one over the other. I think it's most important just to go get the shot in the arm, whichever one it is, just get it. Because both the safety profiles, as Kristen talked about, the data is very, very encouraging. And really, 95% efficacy is just absolutely phenomenal. And so you can't go wrong with either of them.
And each of the vaccines have just about that 95% efficacy. Could you walk us through what the differences are? Because if people are considering different options, what makes Pfizer different from Moderna?
As I said, if you look at the data that was published and the FDA reviewed back in December, the Pfizer study used 40,000, Moderna used 35,000 people, but the side effects and the complications efficacy were almost identical. There's very minimal differences. And as Dr. Professor Mattel would say, is that they're both mRNA vaccines. So there's no indication that if I have this condition or this age group or something like that, I must go to one versus the other. They really are, there's almost no difference between the 2. So I really would encourage people not to try to figure out is one better than the other, because they really are almost identical in my opinion.
All right, thank you for that clarity there. Let's go ahead and bring in another viewer who had a question about the timing of the doses.
If you're unable to receive the second dose of your vaccine within the prescribed period of either 21 or 28 days, and you have to get it later, would that have any effect on the effectiveness of the overall vaccine?
Dr. Ialetti, I'm going to send this one to you again. So is it okay for Diana or any Hoosier to delay the second dose?
Yes, it is. I think the most important thing is that there's a minimum time you have to wait. So you have to wait, at least 2 weeks. But after that, when you get the second dose, ideally within what they say, but it is okay to wait even longer. It's really a booster dose. The most important thing is to make sure you get it. A lot of people might decide, well, I had some side effects and maybe I want to get the second dose. So you may end up waiting, but I would definitely make sure that you actually get the second dose. If you want the best possible outcome, you can make sure you get the second dose. So don't worry as much about the timing, but definitely don't forget to take it.
Here's some now. A lot of people were eager to know the answer to this particular question. How often will we need to take the COVID-19 vaccine? Will it be a yearly shot like the flu, or will we need a booster every 5 to 10 years? I'm going to open it up to anybody who might want to answer this. Anybody have an answer? How often we might have to take the COVID-19 vaccine?
I can go if you like. So I would say at this time there is no efficacy data for long term. So those data will come as the time goes by. That's one thing, that how long the immunity is going to last. Second thing is, after the vaccination of majority of the population, is the virus is going to disappear. So if the virus is going to disappear, then we don't need yearly vaccination. And if significant number of cases are occurring every year, consider in the next November, December, then we have to take this one at least yearly until those numbers go to insignificant level. So I will ask other panel member to continue.
So the verdict is out then. We just don't know quite yet how often we might have to take that vaccine. Is that right?
Yeah.
Okay. Our next question is from Joyce in Greentown, and she asks this: is it a good or a bad idea to take Tylenol or even Benadryl prior to getting the vaccine to reduce the risk of fever or an allergic reaction? Ms. Kelly, we're going to go to you. Is this something that you might recommend?
Sure. So I think if someone has a history of allergic reaction, sometimes the doctor may tell them to go ahead and take a Benadryl, like a preloading dose. We do have that available in our clinic if it is needed, but I don't think it is not something that we are telling people to do. So I would really talk with your doctor if you have concerns, get some feedback on that. But no, it is also important to know and expect that about 2 to 3 days after your vaccine, you may feel a little icky, that feeling like you're fighting something off. You may have a little joint pain. You may have a little bit of a headache. That's normal. And it's a good thing because it tells you that your body, your immune system is working and it's doing what we want it to do with this vaccine. So I think it's good to just expect that going into it and know, especially when you schedule your shot, that second or third day, you may not feel so hot, but you'll be back better than ever.
And Ms. Kelly, I've got a question before we go to the next one. And I've seen this on Facebook, and people are posting pictures of themselves after they're getting a shot or during their shot. Do you get some sort of certification or paperwork that shows that you have gotten your vaccination?
Yes, so you will get a little card from us after you get your vaccine. We'll document your first and your second shot. We do recommend that people take a picture of that card because it's easy to misplace it. And that's an important thing. So you'll want to go ahead and keep that for your own records. But if you lose it, don't worry. We'll take care of you when you come back for your second shot.
Okay. All right. Our next question comes from Nancy in Noblesville, and she told us she just got her first shingles vaccine last week and is due to get her second dose in a couple of months. Here's her concern.
How long do I have to wait to get my first COVID vaccine? And when do I plan to get the second one? I'm concerned about interaction between vaccines.
Dr. Ialetti, what do you tell your patients who need other shots, other injections? Should they postpone the COVID-19 shot if they just got another vaccine?
What we recommend is typically if you get the shingles or other ones, wait a couple weeks and then get the COVID vaccine. You want to get it right away, but give it a period of time, then take it, and it is still safe at that point. Professor Mittal may have more opinion on that as well.
Yeah, I agree, because the shingle vaccine is a live virus vaccine, so it let it, you can say, work for a couple of weeks, and after that, I think having the vaccine should not interfere with the shingle vaccine.
Okay, wait a couple of weeks then. Well, a lot of you also ask us about the cost of the vaccine. The Indiana State Department of Health told us there is no cost to anybody who is receiving the vaccine. The shots are covered by the federal government. When you register, you may be asked, though, if you have insurance. If you do, there will be some administrative fees charged to your insurance company, but no one in the state will have to pay out of pocket. Well, there are some reports online of people dying after receiving the vaccine. Now, this is unclear whether the vaccine is causing that death, but we understand it is worrisome for Hoosiers lining up to take that shot. So we asked Dr. Weaver about those cases.
Yes, we are putting things into place and some pilot programs where we can provide the vaccine to people who are at home. So we'll be working really closely with hospitals, local health departments, and then different agencies who would specifically have the ability to outreach to those patients, or if we're identifying them when, our areas of the agencies of aging are calling people and they identify that they're homebound, to make sure that they can get connected. So that is part of our plan.
Okay, she was actually answering about mass vaccinations there. We're going to bring this question up once again a little bit later when it comes to some people, reports of people dying after getting the vaccine. Not clear if it's from the vaccine or what that is. So we'll get to that question a little bit later in the hour. For this next segment, we want to look a little bit into the future. Mr. Cattell, I want to go to you. What will it take for nursing homes to welcome back visitors indoors and unrestricted like in the past? So many people are wondering this, so that residents can spend quality time with their families. Are we getting close to that point even?
Well, I really hope so. We are all eager for that day. Not only the long-term care professionals that provide the care, but boy, we're really welcoming families to make these communities again and to bring smiles to our residents' faces. Ultimately, as Dr. Mittal and Dr. Ioletti talked about earlier, it's going to be important that we continue to follow social distancing and mask wearing and follow all the infection control procedures that have been outlined, particularly in the healthcare setting. The Centers for Medicare and Medicaid Services and CDC set out all of these criteria related to nursing facilities, which then get applied to most long-term care facilities. So we're going to follow those guidelines. And right now, there's nothing on the immediate horizon for change. We've talked with the health department, and we continue to interface with our federal partners as well. And hopefully we'll have news on what that change looks like in the coming weeks. But there's nothing in the immediate next week or two. It will take time for this vaccine to roll out across the state for second doses and for the efficacy to come through. But we're hoping soon, this quarter, maybe later next quarter. But that's a guess as we wait on federal guidance.
I would imagine it would take us closer to that herd immunity when we could start having a more meaningful conversation about that on so many different scales.
Yeah, Dr. Envy talked about herd immunity and understanding what that number might be. And so we will continue to adhere to the experts' guidance insofar as interactions are concerned, particularly in congregate settings.
Okay, that's great. Thank you. Talking about, getting together and enjoying each other once again, Dr. Emby, this next one's for you. How long? A lot of people are asking, we've got a lot of big sporting events coming up here in Indianapolis. So a lot of people are wondering, when can we return to those large scale events with people standing shoulder to shoulder, Lucas Oil Stadium, maybe Bankers Life Fieldhouse, not wearing masks, and also being able to feel safe as a society in that environment?
Yeah, it's certainly something we all want, and we want it as soon as possible. So there's no doubt that that's something we all want to be able to do. Unfortunately, I think there's still going to be a bit of time. We know that even though, thankfully, we've been seeing the numbers come down in the last few weeks, and we're hoping that that's going to persist and continue on that trend. And the more we get people vaccinated and the more we get to that level of very low level infection, then I think we'll start to have a better sense of that. Until then, it's going to be critically important that we continue all the precautions we have, because the worst thing that we could do right now is lower our guard, especially as we start to hear about new strains that potentially are more infectious and what have you. I just think we need to be very, very careful for the next few weeks and months as we start to get everybody vaccinated and we start to hopefully see these numbers continue to come down. And then I think we'll have a better sense. So as Yogi Berra said, it's very hard to predict, especially about the future. But I would argue that it's going to take some time, and we're probably looking at the earliest, I would argue, would be later this year to be able to start looking at that. In the meantime, I think masks and distancing is going to be a part of our future for still quite a bit of time to come, unfortunately.
That sounds like the theme here. Well, we want to thank our viewers for taking the time to submit and record your questions.
Yeah, we also want to say a big thank you to our panel for lending your expertise and your time to this very informative half hour. But of course, we are not finished yet.
Up next, we'll welcome some frontline healthcare workers to our panel to talk about their experiences during this pandemic. We'll be right back.